All right, so we're next on stage with Carmen Villar from Gilead Sciences. Welcome on stage. Thank you for being here, and thank you for being one of our partners. Yeah, here we go. So we're going to a different region in the world, and we're going to Central Asia and Eastern Europe. So there's an untold story there where we see a growing rise of HIV/AIDS, while we make global progress on this specific disease. Um, the rates of infection in Eastern Europe and Central Asia are increasing, right? So very happy to tell this story today and talk about a recent announcement you made, which is a renewed partnership with the Elton John AIDS Foundation to try to tackle this problem, right? So you committed another $25 million to act in the region and to act on this problem. So can you, before we start going into the partnership with Elton John's Foundation, why do we see this problem in the region, and why do we see HIV/AIDS growing in Eastern Europe and Central Asia?
Thanks, Alex, for that question. And thanks to everyone for being here today. I just want to say, as my colleagues from Abuja leave, or from Nigeria leave, that I actually lived there for a while when CDC Nigeria was just getting underway. And it's quite impressive to see how far they've come and how much capacity they've built. So anyway, I just want to recognize that out loud. And I think, like many other countries, whether it be Nigeria in Western Africa or anywhere else in the world, sometimes we forget what's happening in the HIV world because we've been working at it for a long time, because we've made so much progress, because in places like the United States, you don't really hear too much about it. But in Eastern Europe and Central Asia, because of lots of different reasons, which I don't opine to know or be an expert about all of them, but when we think about war and strife, we think about some of the issues around legislation and criminalization of having HIV or intentionally transmitting HIV. There are a lot of barriers and stigma associated with the disease. And so we've seen, as Alex mentioned, a huge increase in the mortality rates of people dying from HIV in about 20%. Over a 10-year span in Eastern Europe, and up to 34% in Central Asia. So these numbers don't make the headlines because I think they're often overshadowed by the other headlines that are happening in the region, whether it be conflict or other issues. So I think we have become comfortable and have really relied on huge tools like PEPFAR and things in other parts of the world. And I think we just needed to refocus and think about what's happening here and how we may need to approach it in a different way, considering rates of injection drug use and other things that are happening in the region that are maybe slightly different than what we're used to.
So how do you do that, and how this partnership with the foundation, partnership called Radian, how do you try to address some of these issues and improve the situation?
Yeah. So some folks might think it's interesting that we are partnering with the Elton John AIDS Foundation, but surprisingly, they have been doing work in this region for over 20 years. So they had a lot of connections to different NGOs, different partners on the ground. They have a lot of experts that they were able to recruit. In fact, the gentleman, Roman, who kind of coordinates all of this on behalf of EJAF, is a former CDC guy and has been in the region for a long time. And so by us, a large company working with them, a large NGO, they're able to use their resources and the expertise on the ground to actually work with smaller partners who can get into communities that are being infected or adversely impacted by HIV. And I think, there's complexities now, as I keep mentioning war, but it has made it worse. And the president of Ukraine was at UN this morning, so it's very front of mind. But I think, simple things like, not speaking Russian now and in their own country. And so there are even communications barriers that we don't sometimes think about. And and EJAF is very much able to work with these communities through smaller partnerships. And we're talking about grants, they range anywhere from $25,000 up to $300,000. So a varying size in order to get at the communities who need the help.
So it's really about localizing the access and the community-led solutions, right?
Yeah.
So do you have any specific success stories to share or achievements?
Oh, so many.
Or,
Yeah.
share one with that.
Well, we've reached over 300,000 people. We've, through this program, provided 115,000 tests. I think there's more to do there, especially in an area where you're seeing higher incidence. You always need to test more to find the cases. So definitely that was part of our reason for renewing our commitment for another 5 years and another $25 million. But I was at IAS in Munich earlier this year, and we had a chance to sit with some of the clients of the Radium program. And in particular, I met a woman who was there with her son that had become infected or found out of her HIV status when she was pregnant. So I'm not really sure of when she had become infected, but and that her mother had died, and so she was homeless now and really needing help. And there was a small community of women who really helped to lift her up and get her connected with services that were being supported by Radian, and really helped to get her back on her feet. And she was able to come to IAS and tell her story and share her story. And we were able to meet her son. So you were teasing me about no baby this year, because last year I was here and I was able to hold this cute little baby as part of the story. But I got to meet her son, and he was just an amazing kid. He was there with all of these adults talking about HIV, and I'm sure he was so not interested, but he just really was a wonderful, articulate kid. And I thought to myself, we helped bring him into this world and make sure his mother was still around to take care of him.
Right. It's always important to share these human stories, and when we talk about these issues. But so what's next for the partnership? How can you scale some of these solutions, and how can you scale up the capacity of these local actors?
Sure.
So what do you have, like a renewed strategy in the new partnership or the renewed partnership, or do you have a call to action to get new partners?
Yes.
Chikwe was talking about issues around health systems and lack of resources, lack of investment. So let's talk about first, what solutions you think should be scaled from your partnership, or if you have a renewed strategy, and then we can go to the next one.
Well, I think Chikwe was also talking about basic access to healthcare. And I think that's one of the huge hurdles that we have to try to help people overcome, because there are fewer and fewer health care facilities, available in certain parts of the region. And if they are available, sometimes they're hard to get to. We know all of these issues. We have been working on them for a long time, but really drilling down into access. What's it going to take, and how do we support people to actually just understand their status? I mentioned criminalization in the beginning of our chat. And how can we work on policy issues? Policy doesn't take, well, sometimes it does. Not as much money usually as a health or public health intervention. Can we help change some of those laws and destigmatize people with HIV in a way that makes them more open and more comfortable to actually seek care and get on treatment? So there are a lot more things we can do. I have to say we've learned a lot in the first 5 years, and we're really looking forward to doubling down on our localization and our efforts with EJAF going forward. I will just say that we can't forget about this region in our work. We're very focused on lots of parts of the world, and all of us have our specialties or our favorite places to work or areas where we've made a lot of progress. And we just have to ensure that we are spreading what we've learned and sharing the tools that we have to really try to reach everybody.
Yeah, it's important. You're giving a lot at Gilead Sciences through lots of different partnerships. We know about one that you have in Asia, but it's good to focus a bit on this region, Central Asia, Eastern Europe. We don't, even at Devex, we don't talk so much about it. So it's good that we take this story to stage. So thanks so much for that. Any last call to action for partners or people who are in the room that could meet you?
I would just say keep up the great work and partnership. We all talk about partnership in all the work that we do, and thinking about those unique partnerships that you might not otherwise always be thinking about, whether, it might be two companies coming together with a couple of NGOs and the government. We always say PPPs, public-private partnerships. Let's be creative about how we do this work, because as we get to the end, in ending the epidemic, it gets harder and harder, as we know. We have to work more focused, more intentionally, and really, really bring those partnerships to bear.
Great. Thank you so much for your partnership. And so up next, we're talking about access, and we're bringing on stage a youth activist who's working with UNAIDS. So continue on this topic.
Thank you.
Thanks so much.